Welcome to Open BxRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Also, if you're watching us on cable, stay up to date with our on-screen social media feeds, providing the latest COVID-19 and community updates and important headlines. Coronavirus testing. How can you access it? Who qualifies? And where are tests being offered? Joining us now to provide some information is Dr. Denise J Nuñez, Pediatric Intensivist at the Children's Hospital at Montefiore and a community-based provider at Somos, who has been working at the Lehman College drive-through COVID-19 testing site since it opened last week. Welcome, Dr. Nuñez.
Thank you.
Can you just tell us about yourself and your work with Somos?
So I am, as you mentioned, a pediatric intensivist. I'm a critical care physician at Montefiore in the hospital. And also with Somos, I own also some private practices. So I work in the community. I serve back to my people here in the Bronx, our Latino community. And Somos is an amazing network of physicians. Managed by Dr. Lehman College, and he's been amazing supporting us, helping us serve the community. And one of his innovative practices that he was able to do was actually open at the Lehman site, one of the the first drive-through sites for COVID testing or coronavirus testing for our Hispanic community.
Right. Doctor, can you tell us more about the testing sites, that one in particular in Lehman, both the walk-in and the driving sites?
So what we were trying to do is see how we can. So the numbers are not don't really reflect our community, and our community doesn't have really all. We're underserved. We normally everything gets tested a little bit last, sadly. So it doesn't really reflect how sick we are. So we, Somos and Dr. Talach decided to open this, looking for like a convenient place, and we were able to find Lehman College, their parking lot, which is huge, and it's right in the middle of the Bronx, and it's a great accessibility for patients. And we were able to open this site last week, where people can drive through and can get tested if they have the symptoms. Definitely, you have to you have to have some symptoms. You have to make appointments to come in. We sometimes have spots available that people can actually come in and walk through, but in reality, it's drive through. So you have to have a car, which is the only sort of like we were thinking about. Oh my God, is that a good choice? But it's the only choice that we can right now offer, because we cannot have testing at our practices. You exposed other people. You have to make sure you have the right equipment when you do the testings, and so you don't get exposed yourself as everybody that's around you. So that's one of the most important things. That's why it's a drive-through. You only, you're very protected. You go through your car. We just open the window right there where they test you, close it right away, and everything is asked through the window. You don't bring the windows down. So it's like talking through the window and writing things up so people can see. Mm-hmm.
And Doctor, speaking of the hotline, what are the steps for calling and making an appointment for those that are concerned about this right now?
Yes. So anybody that's concerned, they can call the 1-833 Somos NY. So Somos is SOM as Mary, OSSM, N as New York, and so NY. They should call they should give us their address, their phone number, first and last name, date of birth, and the contact number so we can call them back, and tell us what's going on with them. So if they meet the criteria, then we'll give them an appointment at the site, a date and a time that they should come in and drive through, and we'll give the testing. If they want, let's say if one person is positive or one person meets the criteria, then whoever comes with them, if they come as a drive-through, will also be tested.
Got it. A lot of people, doctor, have been calling the hotline, and they have a concern that they're not able to make the appointment right then and there. But can you just clarify that you're going to call them back? Can you just clarify that step there?
So what happened is that a lot of people are calling also because they just want to be tested. There's not a lot of tests. That's the thing. We have to be careful. So there's not a lot of tests available. We're doing the testing for people that have meet all the criterias, which is if you're very sick, if you're coughing, have shortness of breath, if you have fever for several days, and if you've been in contact with somebody positive. we will give you a time and a date to come. So if you call and you haven't been called back to come in for an appointment, it's because you don't meet all the criteria. And we do tell people, but some people, they really just want to be tested, and they keep on calling and calling, and that's when they say that they don't get called back. Um, and what happens sometimes is that we only have certain amount of specimens we can do a day. So if you don't get called back that day, you'll be called like in the next several days. We have people calling them back and making sure people are fine. Yesterday, I spent all day, even though I was in the ICU, people kept on calling me, and I spent the entire day just telling people, what's going on, how can I help you? And there were people like diabetics that were just concerned that they were exposed, but they feel fine. So I just told just keep on checking your blood sugars. Make sure you're not out of breath. If you're out of breath, then call us back and come in. But don't go to the ER. I'm just going to the ER. Check moms. Like, no, don't go to the ER. We're completely booked in the ER, and then there's a lot of sick people there, and you won't be able to treat you. You're going to stay there for hours, and then you're going to definitely get sick. So yeah, so just be patient with us, please. It's not a lot of tests out there. We're really trying to get the sickest people tested to make sure that we capture a good amount of patients.
Right. And we spoke about the drive-in, people come in with their cars. What happens at the testing site? You said they put a stick in your mouth and they
I know. It's yeah, people don't like it. It's
right.
terrible.
Procedure just about what that procedure is, and should people be worried about the testing, or how does it work?
So when you come in, your name will be there registered. Then they'll ask you to go around until where the big tent is that you're going to go with your car inside. Before you have to present a paper that's going to be shown at the window site when you see us, and when you see the doctors or the people that are doing the testing. Then once they confirm it's you, they will ask you to bring the window down and put your head kind of flex a little bit, extend your neck and close to the window. One of the providers, it's going to have a stick. It's a very flimsy stick. It looks like a Q-tip, but a long Q-tip. And they're going to put it inside your nose. And that's going to touch all the way to the back. So one of the things we ask it, because it causes cough, we ask it to please turn your head to the side. So if you're going to cough away from us, even though we're protected, but we want to make sure we don't get also still infected. So it goes all the way to the back. We move it a little bit for a couple of seconds, and then we take it out. So you can imagine putting a stick all the way to the back of your nose and then moving it. It really causes you to cough, like just by thinking about it, right? So once they take it out, it goes into a container. It closes. You close the window, and on your way you are. And then we'll give you a call back later on to let you know for the results.
How long do the results usually take, doctor?
So they're taking anywhere from 2 to 5 days, depending on the lab. There is a new FDA approved. I actually started using it, and we started using it already in the hospital, where it can take less than a day to get the results back. But depending on the hospital that we're using the lab, it takes anywhere from 2 to 5 days.
And we've also read that the sites have been backed up a little bit. There's, a lot of people coming by. Has it been the cause of the slowdown in appointments and also test results coming back to people?
Yes. It's a lot of people. It's a lot of people coming in, a lot of people asking. It's hard to turn people away. So we try to sort of like fit them in right there, make the phone call from right there, register them, and because they're sick, right? So you don't want to turn people away. So it does cause backup from the people that are calling in. It's a lot of us. It's a lot of us here in the Bronx. It's not a lot of test sites, right? First of all, and then not a lot of kits. And also remember, we're all providers, and remember that we're actually, they're using us in so many places, right? So the nurses, we're not a lot. The nurses are getting sick, right? The doctors are getting sick too, right? So it's we're kind of few and few. So it's not a lot of us. So people also, just take that into account, that, I can only work 24 hours in a day. I can't work more. You know what I mean? Like, there's no more. It's just not more about more of me, right? So more of us. So it's a little bit hard sometimes, but we'll get through it.
Right. Thank you so much for your work. I know right now there's just a lot going on, especially in our borough. And the fact that a lot of nurses, a lot of doctors are feeling that burnout too, to get sick as well. And you have to be healthy as possible in order to protect the patient.
I know. And our families, right?
Yes.
Yeah.
let us not forget that doctors and nurses and all the healthcare workers have families as well.
I know I was in the ICU on Saturday, and we were so grateful that, um, I mean, we don't eat, right? We're like all day, and we forget. Like it was like 3 o'clock. We totally forgot that we're not even taking like water.
Oh my
And one person was kind enough to send us food, and we were like all like together, like food. Oh my God! So we all sat down for like 2 minutes, literally, to eat food, and somebody came in that literally just walked in, and she goes, "Oh, so how many patients?" We all went like, "Shush, we need 2 minutes to just like eat." And
God.
everybody was like, "Oh, I'm so sorry." Like, no, we really just needed 2 minutes to eat. So yeah,
Another question that a viewer had asked, if they get COVID, how long do they know when they're not contagious anymore for COVID?
it's kind of hard, right? So what we're telling people is that as soon as you feel that you're sick, right, to stay in quarantine for at least 14 days. So it's lasting about 14 days. Have we seen a little bit more than that? There's not a lot of data on it. So 14 days is sort of the, you should not be contagious out of 14 days. Now, do we know if people are getting co-infected? We don't know yet. We don't know all the data. So we don't know if like you got infected, then you got better and you get infected again. So if you got infected, right, and you get better and you for some reason go out or get in contact with somebody else, you must go again in quarantine because there's not enough data out there, okay,
And
to prove it.
just to close out, a little bit
Yeah.
of advice from you to the viewers at this time.
Uh, I would say to really take this serious. Um, I think that people are not really, everybody is understanding what's happening. The youngsters, a lot of millennials, a lot of people understand it, and others don't. It's not protecting yourself only; it's protecting who's around you. Very sadly have to say that I just lost a coworker yesterday night, so it is very very hard because he was our friend since 2005, and he just got it on Thursday, and he just died. So I have a lot of friends they're intubated. I have a lot of nurses that I know. They're very sick, and it is very very it's real, and it's very sad to see them sick today and not see them tomorrow, and they're just like me.
Mm.
So so we're in the war zone. We call it the war zone because it literally feels like the war zone, and when you know that you can prevent it just from washing your hands, just from keeping distance, just from making sure you don't touch your face, just for keeping social distance, and you see people sometimes that don't, I can just say today, in my experience, I was in my practice and literally a dad walks in with his child. He was perfectly fine. And then, he you know, you ask them questions, and thankfully we ask questions right at the beginning so they don't walk in and don't infect everybody else. And if we don't ask the questions, they don't say, yeah, sure, somebody in my family has COVID or it's positive, or so just be upfront, like be careful with your neighbors. Like if you know that you've been in contact with somebody that is positive, even though you don't have the sign and symptoms, just just be careful of your surroundings. You don't know if you have a grandfather that's with you that has cancer. You don't have somebody who's immunocompromised at your home. So just talking to that other person and transmitting the virus, even though you feel great and you might feel great, but you don't know if you bring it home that person can get your family member sick and they can die. So I would say just be very self-conscious of how it's spread and just contage it. Let's try to keep ourselves in isolation for a little longer to see if we can bring this down a little
Right.
bit.
Dr. Nunez, thank you so much. My condolences to you and your team on the loss of
Thank
your
you. Thank
mate.
you.
So
Thank you.
sorry for your loss. And thank you again for your time today and for joining us and giving us this helpful information to our
Oh my
viewers.
God, you're very welcome. Such a pleasure.
Open BxRx will be right back.